Hello everyone, and welcome to your first clinical quarter here at Rasmussen College. This is the Fundamentals of Clinical Laboratory Techniques, and this is the online lecture piece that will go along with the lab portion that you'll have residentially. My name is Carissa Legg, and I'm going to be your instructor for the next 11 weeks, and I'm actually based out of the Rockford campus. And each week, what I'm going to try to do is put up a weekly video to discuss some of the highlighted topics for the quizzes and for the chapters that you'll have for the week. So for Module 1, what we're doing is we're focusing on the medical assisting, so kind of the core of that, as well as professionalism. So with that being said, we're looking at 3 chapters this week. We're looking at Chapter 1, Chapter 2, and Chapter 59. So what I'm going to do is go ahead and start talking about each of these chapters individually and kind of touching on some of the more important pieces that I feel will be important for you to know leading into the week. So let's go ahead and start with Chapter 1. So this chapter is really a good introduction into the healthcare field. Now some of you may have experience in the field, and if so, that's fantastic. I think that's great. But be mindful that not everybody does. This may be something very new for them. Medical assisting is a newer part of the medical world, and it was developed due to rapid changes that have appeared throughout the healthcare environment. Medical assistants can really work in a variety of settings and clinics, but the skills that are required are the same no matter what outlet you are working in. Now, before you can really understand what a medical assistant is, we need to discuss some of the history behind this field. Once upon a time, a medical assistant worked in the field with providers, and they were trained by providers. But due to an increase in responsibilities and liabilities, medical assistants are now required to have formal training. This is where the American Association of Medical Assistants, or the AAMA, was formed. This was an organization formed in 1955, and it was the first organization to place an importance on educational objectives of medical assistants. Medical assistants may obtain a certification, a diploma, or an associate's degree in medical assisting. And in order to complete any degree, you have to go through an institution that is accredited. Now, what that means is that they need to meet expectations and standards set forth by an accrediting body, such as the Commissions of Accreditation of Allied Health Professional Programs, or CAHEP, or the Accrediting Bureau of Health Education Schools, ABHES. We here at Rasmussen are ABHES accredited, so you don't have to worry about that. We are accredited through this program. Now, it's important to know that the AAMA is a nationally certified agency, and its headquarters are right in our backyard of Chicago, Illinois. The AAMA offers a Certified Medical Assistant, or CMA, credential. Once successful completion of a program accredited by CAHEP or ABHES, students may sit for their certification CMA exam. Once you become certified, you will need to maintain that certification. And that is done through either having 60 hours of CEUs, or continuing education units, in 60 months or 5 years. Or if you do not complete those hours, you'll have to retake your certification exam and pass it again. Now, it's important to know that you do not have to be a member of the AAMA to take and sit for the CMA exam. However, becoming a member of the AAMA has great advantages for you as a medical assistant. And I know that that's going to be something that you are going to be talking about in your clinical courses this week, the lab courses, so I'm going to let your lab instructors kind of help you with that. Now, along with that, the responsibilities of a medical assistant are very extensive, and that's why we had to have the training and education that you receive, and why it's so intense, because it also provides a great deal of hands-on work so you learn with your hands. Now, always remember that you must perform duties that are within your scope of practice. Doing tasks that go beyond that could result in you harming a patient or losing your certification. The responsibilities of a medical assistant fall into two categories. They're either administrative or clinical. Administrative are more the front-end tasks, such as scheduling patients, co-payments, billing, things like that, where clinical responsibilities are more the back-end things, vital signs, rooming a patient, helping during procedures, all of the more hands-on pieces. So that's going to wrap up Chapter 1 for us. Let's move to Chapter 2, which is really discussing the history and the influence of individuals throughout the medical field. One of the most important individuals is Hippocrates, and he's really known as the father of medicine. He stressed that the body's healing nature helped to form descriptions of diseases and helped to discover the ability to identify diseases by listening to the chest. Hippocrates is credited with creating what we call the Hippocratic Oath, which is what physicians take before they enter the field. It's a guide or a pledge that they will do no harm to patients, prescribe no deadly drugs, and give no advice that could cause death. Now, there were some other very important and influential people, but I'm going to leave that up to you to read for this week. Now, Chapter 2 also goes through the different types of medical practices that you could work in and that are available. Further into the breakdown of medical practices is the different specialties found within the medical world. It's important that you know that most medical specialties do allow medical assistants to work within their fields and their offices, as most job opportunities for medical assistants are in the outpatient setting, but that could be rapidly changing, and we may see a shift where medical assistants start to work in more inpatient or hospital settings. The last section that I want to talk about for Chapter 2 talks about allied health professionals. It's very important that you understand the difference between the individuals who are certified, licensed, and registered. Certification or certified means that they are involved in being issued a certification or credentials by a professional organization to one that has met the education and experience of that organization. So, for example, a CMA is a certified medical assistant through the MA. A license means that a government agency, usually a state agency, authorizes that an individual is able to work in a given occupation. For example, you could have a LPN, which is a licensed practical nurse, or an RN, which is a registered nurse. Now, a registered nurse falls under that because of the fact that they do have to have a state accreditation, and they have to be licensed by a state. And the last one is a registration, which means that a professional organization in a specific health field administers exams and maintains a list of qualified individuals. And each year, those qualified individuals will have to re-register themselves on a list, just like you would for voting. An example of this would be the RMA, or Registered Medical Assistant, through AMT. All right, and let's kind of jump into Chapter 59, which talks about professionalism. So, beyond having these skills that we've talked about, there are other important skills that you must possess as a medical assistant. For example, you need to have good teamwork and good technical skills and soft skills. So beyond having those, you have to have good teamwork skills. Know that you can jump in and be a team player, show your initiative, and help when you know that it is needed. Be proactive and a self-starter. Know what your provider will need before he even has to tell you or she has to tell you. Know how to manage your priorities. So know that you have to have good time management skills. And be persistent. If you know that this means that you have to stay on task longer than usual, then don't give up. Okay, don't get frustrated and give in when things get tough. Now, with your professional image, what we're talking about is how you look on the outward appearance. So regardless of the dress code, you want to always have that professional image. Your clothing should not reveal any breasts, waist, tattoos, or underwear. And make sure that they fit appropriately. You don't want them to be overly big or way too tight. You should not have any artificial nails, as those can harbor bacteria and you want to keep your nails short and trimmed. You want to make sure that your jewelry is within an appropriate setting. You don't want to wear any big gaudy jewelry or big pieces of jewelry, and no large earrings, as those can actually be tugged on by small children and can cause a lot of pain. Make sure that daily you're brushing your teeth and your hair, and you don't wear any strong perfumes or deodorants, as some patients could have allergic reactions to them. And the last thing I want to talk about is communication. So communication isn't just between you and a patient, it's really between you and anyone in that physical office. Providers, other medical assistants, nurses, front office assistants, lab technicians, or even people that you are emailing or sending faxes to. All of those are communication pieces. And we have both written and verbal communication. Written communication is the physical talking or even emailing or faxing, and making sure that you're using appropriate professional language and no text abbreviations. The BTW, that will have to wait until after you get off that day. And verbal is what we actually say to people, how we actually communicate with our words. Make sure that when you are using this communication piece that you're actively listening to your patients, other staff, or even your own personal medical assistance needs. Making sure that you are speaking to be understood. So that means using clarity in your speech, enunciating your words, and speaking slowly enough that people can understand you. And try to seek to understand. Don't just listen to have a result. Listen to help. All right, guys, that is all that I have for this review of chapters 1, 2, and 59. Again, those are still your responsibility to read in full, as that will help you with this week's discussion post and this week's quiz. So for your discussion post this week, what you're doing is you're looking at professionalism in the workplace. And what you're going to have to do is think about an externship, and you notice that one of your extern students has been answering her cell phone while she's rooming patients and checking her personal email and completing her coursework instead of participating in her externship duties. And there are 3 questions that you need to answer. So what is the professional expectation while you're on externship? List the professional qualities that should be displayed at all times. And knowing that your ultimate goal is to get hired from externship, what will you do to stand out during that time? Now, your initial discussion post will be due by Thursday, July 6th, not Tuesday. With the delayed start, we're moving that out just a couple of days. So please make sure that Thursday, July 6th, you have that initial discussion post done. Remember that it has to be written in APA format with references and in-text citations. And if you're looking for what I'm expecting of you in your discussion post, please review the rubric that is under the Module 1 course folder. Okay? You need to reply to at least one classmate's discussion post no later than Saturday, July 8th by midnight. And then you will have one quiz this week that is 20 multiple choice questions. They're all dealing with chapters 1, 2, and 59. And you will have a 30-minute time limit on that. So please make sure that you complete that no later than Sunday, July 9th by midnight. If you have any questions or concerns, guys, please make sure that you reach out to me either via course messaging in Blackboard, or my direct line to the Rockford campus is on your course homepage just to the right of my photo. That's in the top right-hand corner. I hope you all have a wonderful Module 1, and welcome to Rasmussen and your medical assisting clinical courses. Bye, guys.